Hello and welcome to this McGraw-Hill Education Learning Conference. I'm Lindsay Survey with McGraw-Hill Education and I will be the webinar moderator for today's session. Before we get started, I'd like to go over a few quick housekeeping items. This event is being presented in listen-only mode, which means you will be able to hear the presenters, but they won't be able to hear you. However, that doesn't mean you cannot participate. There will be polling questions throughout the presentation. In addition, we will hold all questions until the end, and you are welcome to type them in the Q&A panel on your screen throughout the session. Joining us today is Dr. Nancy Marchand-Martella. Nancy's session, titled A Review of Explicit and Systematic Scripted Instructional Programs for Students with Autism, will guide you in evaluating valid solutions to meet this student population. Dr. Marchand-Martella has more than 28 years of experience working with at-risk populations. She is a professor of special education at Eastern Washington University, teaching classes in instructional methodology. I'd now like to turn over the section to Dr. Marchand-Martella. Good morning, Dr. Marchand-Martella.
Good morning, Lindsay, and good morning, everyone. Or good afternoon, I guess, for folks on the East Coast. Appreciate the opportunity to be with you today. The presentation today is really predicated on a review that we just completed and had published, and I'll show you that publication as we move through this presentation. And it really is focused in on the scripted kinds of programs that we can use with individuals with autism spectrum disorder, but we're going to specifically look at direct instruction programs as a solution to assisting students in the area of oral language, reading, mathematics, for example. So we'll go ahead and get started. Before we get into the various programs, I just wanted to make sure that we're all on the same page with regard to the new diagnostic criteria for autism spectrum disorder. And that would include persistent deficits in social communication, typically a severity of social communication deficits, and also social interaction deficits. And these need to be displayed across multiple contexts, multiple environments. The severity of behavior is evaluated on a level system from least severe to most severe, but also in terms of level of support needed from the student, and this is based on, again, the communication impairments, but also on these restrictive, repetitive patterns of behavior that we often see. The symptoms for autism spectrum disorder, and I'll call that now ASD, must be present in the early developmental period, and usually you'll see that around 18 to 24 months of age, but you could see it earlier than that. These symptoms cause clinically significant impairments, again, in social, occupational, or other important areas of functioning. And then disturbances aren't explained by intellectual disabilities or global developmental delays. So now that we have at least that background in terms of the diagnostic criteria, I just wanted to go over some statistics, and these are from the Centers for Disease Control and Prevention. The current stats on the percentage or the number of kids with ASD is 1 in 68. That ASD now is indicated as 5 times more common in boys, about 1 in 42, than girls, 1 in 189. About half of all children with ASD have average to above average intellectual functioning. And that's important to remember as we start looking at different programs. Early intervention can greatly improve a child's development, and what we really need to remember is the earlier the better. So if we're seeing deficits in social communication and so forth, the earlier we start intervention, the more likely that we are to make improvements in the child's performance. A notable treatment is applied behavior analysis, and I don't know if you noticed that I'm also a board certified behavior analyst as well as having my doctorate in special ed, but ABA is the leading treatment approach for individuals with ASD, and it is predicated on teaching skills, and so we're always looking at positive behaviors and reinforcing positive behaviors while discouraging negative ones. Now there was a large research review that was conducted by Wong et al. And I would strongly recommend that you take a look at that. It's evidence-based practices for children, youth, and young adults with ASD, and this really does speak to what has been shown to work for this population of students. And their finding with regard to the topic that I'm covering today, direct instruction, indicated that they offered some promise, and notice the word some promise, as an evidence-based strategy. And the reason why it's some promise is that it should be researched further with this population. And when I go through the studies, you'll see what I mean, that there is great promise with regard to the effects that we're producing, but we need to do more replications and use more of the programs with this population of students. So we'll get in and really take a look at the studies that have been done using explicit instructional programs, and you'll see what I mean. Now, the effectiveness of direct instruction across populations is widely known, from general education populations to students with learning disabilities, at-risk students, and so forth. And if you'd like to read research reviews on the various academic areas, for example, reading, math, language, and so forth, I would encourage you to go to this bottom website, the McGraw-Hill online research website, and you can find all of these research reviews. You can also find a wealth of research information about direct instruction at the National Institute for Direct Instruction website as well. So you've got two places to go. Again, this is overall effectiveness research on direct instruction as an instructional program. Now, you should also know that beyond the research reviews that you can find there are also many research reviews and analyses done by outside sources indicating that direct instruction programs produce positive effects in academic areas, and also having additional gains in the area of positive behavior or on-task behavior. So again, we have What Works, the Florida Center for Reading Research, and so forth. But not only do we have research evidence noted by McGraw-Hill, of course, and the National Institute for Direct Instruction, but we have outside sources indicating that this program is effective with students overall. So this is the study that we just had published in the Review Journal of Autism and Developmental Disorders. It's a 2015 publication. It is a review of programs on explicit and systematic scripted instruction, and we specifically targeted it for students with autism spectrum disorder. So I'm going to go over all of these programs, but again, the emphasis is on direct instruction, Big DI, the programs published by McGraw-Hill. And this was done with colleagues from Michigan State and the University of North Carolina. Now, before we get into the study, because I'm using the terms systematic and explicit, I wanted to make sure that we're all on the same page with regard to that. So let's take a look at the definition of systematic. And systematic essentially means that there's a logical sequence or order to maximize learning. And if you think about it as a staircase, we're talking about the various steps that lead up to goals. And so again, in terms of systematic, there's an order. If we're going to be teaching students to read words on the page, we would first teach sounds. The sounds would be used to blend to form words. Words would form phrases. Phrases would form sentences, and then connected text as an example. So systematic just means there is a logical order, and it is very carefully sequenced to ensure that students are getting it right. The definition of explicit, if you want to look at an easy way to remember it, is I do, we do, you do. And that's more of a demonstration prompt practice paradigm where students are shown how to do the skill. They have multiple opportunities to practice the skill, and then they have opportunities to perform the skill on their own. There's lots of review, lots of checks for understanding, and active participation on the part of students. So again, we are only looking at systematic and explicit instruction in this particular review. Now the method for this study included the following. We found 45 studies, and we had multiple individuals looking and got agreement on those 45 studies. But then what we had to do is we had to pare down those studies to ensure the following: that the participants had a diagnosis of ASD, and that we could disaggregate their data, because there are studies where kids with ASD are involved in the instruction, but it ends up being in a group along with other students with disabilities, and because we couldn't tease out their data, we didn't include those studies. So you can see why now we're starting to fine-tune the analysis and look at those studies that are only with students with ASD. The second one is that the independent variable, or that which was studied, had to be a published, explicit, and systematic scripted program. Again, there were some studies that included explicit instruction, but they weren't published programs. They were author-developed. And then the third one was that it had to be an experimental or quasi-experimental study, that if it was more of a narrative or naturalistic kind of study, we did not include that, because we were looking at studies where we could make certain causal statements based on the information. Now here are the studies, and I'm just going to walk through some commonalities across these studies. Again, these are the 9 studies found specifically identifying students with ASD, specifically using scripted programs, and then explicitly using either an experimental or quasi-experimental design. The first 2, Flores and Gantz, 2007 and 2009, used the direct instruction program Corrective Reading Comprehension A. The students in the first study and the students in the second study are the same students, both 11 and 14 years of age. And what they did was they targeted certain exercises within the program to teach, and what they found was that students did in fact make improvements in oral responding based on the instruction provided in the program. So 1 and 2 are both with Corrective Reading Comprehension A, which is the lowest level of the corrective reading series in terms of the comp strand. If you zoom on down, and I'm going to move down here to number 5, you're going to see that there is the Infantino-Hempenstall study using corrective reading but not comprehension. It's the Decoding A program, which in the levels of decoding is the first level of that program. It was used by one child with a parent instructor, so the child was 7, and improvements in reading were noted in that study. Another corrective reading decoding study was the Peterson et al. Study, and I'm an author on that one. That particular study used the entire corrective reading decoding B1 program. It was with a 16-year-old student who essentially had his parents had been told he probably would never learn to read, and so this student in high school learned to read using this particular program. So improvements in reading were evident. If we go back up to the Gantz and Flores, that program was Language for Learning, and 3 students were involved, 10 and 11 years of age. The program incorporated the identification of common materials, so the entire program was not used, but exercises within it were used. And positive effects on oral responding were noted. That's the only other Language for Learning program that's been used to date. We also have Connecting Math Concepts, which is a direct instruction program. That program, again, in terms of levels, was level B. And 3 students were involved in that study, 6 to 8 years of age, and improvements in time telling were noted, and only the time telling exercises were provided. Then if we go back up, we've got Vimeo Sprout, and then there's Head Sprout down on the bottom. Those are computerized early reading programs for students, particularly targeted for students with ASD. And in the first study with Grindle, 4 students 4 to 6 years of age were involved, and improvements in reading were noted. And then down on the bottom, the Head Sprout program, 1 student 9 years of age participated, and improvements in reading were noted as well. And then finally we have the Solve It program. It was based on problem-solving routines published for math improvements. And 3 students were involved, 13 to 14 years of age, and math skill improvement was evident. So that just gives you an idea of the various programs that were used, the age groups, and the performance levels that were evident. So for the direct instruction or big DI programs, we have language for learning that was used, we have corrective reading, and as I noted, we have the comprehension strand and also the decoding strand. We had connecting math concepts was also used. We had Head Sprout and Mimeo Sprout, and then the Solve It program. So these are the various programs that were used in the studies that were located. Now, one thing to keep in mind was what was so effective about these various programs. What were the promising instructional components? And let's take a look at those. And all of these studies that I'm noting include students with autism spectrum disorder. Number one, high rates of accurate responding. These programs actually get kids involved and give kids multiple opportunities to respond and get feedback, which is important for this population. Another, again, immediate feedback, meaning students don't have to wait to know if they're getting things correct or incorrect, again, which is important for students with ASD. The carefully sequencing the instructional targets so that we're building on success in small units. And I want you to keep this one in mind because this one's going to serve as a foundational aspect of the rest of my presentation, and that's predictable instructional formats. Students with ASD do very, very well when they can learn a routine and that routine continues on. There's a level of predictability and comfort for students with ASD. Interspersed skill instruction, meaning once you've learned it, it actually is practiced and reviewed over time. And what I want to do now is the one that I just told you to keep in mind, and that is the whole routine aspect. I just want to talk to you more about that, and that actually zooms in on the whole notion of having a scripted program. So let's take a look. This is a pretty famous study with regard to scripted programs by Nancy Cook and colleagues, and she compared scripted versus non-scripted instruction. What works the best, and then what do teachers think of it, and what do kids think of it? And here are the results. We're just going to look at scripted instruction. But number one, the highest number of instructional opportunities happened, meaning the kids got to practice more when it was scripted. That the students were more on task and had fewer behavior problems when it was scripted. Better academic performance was evident on Dibble's benchmarks. There was higher treatment fidelity, meaning that the teachers didn't leave out crucial contents or elements. And here's the one that I found interesting. Teachers liked it better, and so did the students. And these students were students at risk. So again, this serves as important foundational information if we're starting to think about what might work best for students with ASD. Here's a sample scripted program, again, just to make sure everyone's on the same page. This is from Reading Mastery. Script being the teacher knows what to say and what to do, and there are also the sample words in terms of what the kids are supposed to say. And lots of choral responding, so if a couple of students are working together, the kids would come in together. If it's one-on-one, then the student would provide all of the responses. So why use a script? Consistency across teachers is certainly important and happens with a script. Allows teachers to achieve the same results as those found during field testing. Decreases the noise in the system, meaning that we're doing what we need to be doing. Allows teachers to build prerequisite skills, and remember we talked about the whole notion of systematic instruction. It frees teachers from having to go home and develop curricular materials at night, for example. It helps ensure higher academic performance, better on-task behavior, and positive responses. But that's the one I want you to keep in mind. It gives students predictable instructional routines. And again, for students with autism, this is very, very important. We're going to go through 4 big ideas that are found when you start to look at direct instruction programs. There are elements that make these programs very effective, and when we're looking at routines and the whole notion of increasing performance for students with ASD, the predictable routines, the comfort levels, and so forth, these are 4 aspects that really do make a difference. So we'll go through these again. Remember, direct instruction programs. However, if you're just doing good solid instruction, these are 4 things that you could keep in mind and actually implement in your own classroom. Number 1 is setting expectations. The research behind expectations notes that classroom organization is enhanced when we have clear expectations, and I'll go through and give you some examples. That when teachers actually set up expectations for various routines in the classroom, the probability of behavior problems occurring actually decreases. So students, again, can predict how they're supposed to act, they know how they're supposed to act, and so forth. And then appropriate behavior is much more likely to occur, and the class will run smoothly when expectations are taught. So the development of effective expectations. Direct instruction programs, as an example, use the acronym STAR, that stands for STAR, that stands for sit in the learning position or sit tall, track with your finger, answer on signal, and respect others. So if you could use the ones that are in DI programs, or you could develop your own, but the number of requirements should be kept to a minimum of 4 to 5. Simple language is important to use. It's easier to teach to students, and students can remember them. They should be positively stated rather than negatively stated. So rather than don't slouch, it should be sit in the learning position. They should be posted in a prominent location. If you're running a small group, great location would be behind the teacher so that the students can see it. They should be monitored and periodically reviewed. Now, in the classroom, we want to take a look at how we're going to provide instruction, whether it's one-on-one for students with ASD or whether we're going to use small groups. First thing would be to have materials ready, and having the materials ready means we're going to, right out of the chute, provide instruction so that there's no wait time and no time for students to go off task. That we will determine seating arrangements, again, one-on-one, side-by-side. If it's 2 or 3 students in a group, then the teacher needs to ensure that the students can see the book, and that, for example, if the teacher's seated here at the kidney bean-shaped table, a student who might be might exhibit more behavior problems might be the student who's directly in front of the teacher, as example. And then we want to actually rehearse and teach these expectations, and those should be done anytime a routine changes. So if we're going to be teaching reading in a small group or math in a small group, and then we move to standing in line or students going to the playground, those would need to be taught as separate instructional routines. Anytime you teach the expectations, remember the 3 do-its, and that would be I do it, we do it, and you do it. So if you look at the sit in the learning position expectation, the teacher should model what does it mean to sit in the learning position during the I do it. The teacher then involves the students, having the students practice sitting in the learning position. During this time, the teacher might also show students what it means to not sit in the learning position, and then have a game, for example, where the teacher can say, okay, I'm going to show you some different ways to sit. You tell me, thumbs up, if it's sitting in the learning position or not. And then the student should be asked to sit in the learning position during the you do it, and that's when the instruction can take place. So again, number 1 was setting expectations, and those are evident in DI programs. STAR is the one that you'll typically see. Number 2 is increased student engagement. And this is important for students with ASD. They need multiple opportunities to practice and get feedback. Remember the predictable instructional routines. So the research behind student engagement indicates that the higher the level of opportunity for responding, the better, and you get better academic and social behavior. It doesn't give kids opportunities to go off task. The more that students get these, the less likely they are to misbehave. Lots of research on that. and that the research demonstrates positive effects in terms of on-task academic engagement and the number of correct responses when we have high levels of OTRs, opportunities to respond. And that really is the hallmark of direct instruction programs, are lots of scripted responses that the students need to provide. Here's an example of a program. It's Early Interventions in Reading. And again, you'll notice it's a scripted program because the script is over on the side, and here's where the students would actually be responding. You can see the struct says, what's this letter sound? The students would say, and then there's a sound it out, and then it's read it the fast way. And what you need to keep in mind is that normally in direct instruction programs, there's lots of group work, so you can see all of this is done as a group exercise. And then once the group is firm, then you can do what are called time for turns or individual practice. And that's a hallmark of direct instruction programs where students get to respond. They feel safe in a group. They predict, I get to respond with my fellow students. And then there's a time for terms where the name is at the end of the directive. So sound this word out, call on the student's name, and then read the word the fast way. And the student would do that. And you'd move through the list in an individual format. Definitely a hallmark of DI programs. Now, I showed you a program that the orthography pretty much matches what kids would normally see in the classroom. However, students with autism sometimes benefit from having additional prompts, and particularly when those prompts are set up to get correct responding, and then those prompts are faded. And here you'll see the sounds and the orthography style that's used in the Reading Mastery program. And I've personally used this with students with autism. It works very, very well. The prompts help students to discriminate the long E from the short E, as one example. And again, what's nice about the Reading Mastery orthography is that it does fade out over time, but it allows a student to get things correct much more quickly. So it's something to keep in mind when you're working with students with ASD. So again, that second one was increasing student engagement, and again, we've already built on the expectations. The third one is providing praise, and if there's really anything that we could do that would make a difference in the lives of kids, it's being much more positive with them and really focusing in on reinforcing their attempts and their participation. So let's look at the research behind praise. The importance of praise cannot be overstated, just as I mentioned. That praise has been cited as an effective strategy for promoting school achievement and positive classroom behavior. And even among students with high externalizing behaviors, meaning students who act out, students who are aggressive, students who have high levels of negative verbalizations, praise has been found when you praise appropriate behavior that you do get a corresponding decrease in problem behavior. And one thing I'll recommend there is something called the fair pair rule, that anytime you look at reducing a problem behavior for students with autism spectrum disorder, you always want to increase a positive. It's called the fair pair rule. So we don't just want to decrease a negative behavior or a problem behavior. We always want to put a replacement behavior in its place so that the student does have something that's much more positive to rely on. And if you think about direct instruction programs, the praise is actually scripted in. Of course, you can provide even more than that, but what's nice is there are the prompts for the teachers to get in there and actually praise student performance. So praise considerations. Specific praise is better than general praise. And again, you can certainly use general praise, like good job, wow, awesome, but specific praise actually tells the student what he or she is doing correctly. And you'll note in direct instruction programs that specific praise is a mainstay of the program, typically something like yes, and then whatever the student said. And the performance criterion that we're looking for specific praise is 50%, meaning that of all the positive things that are said to students, we typically want at least half to be specific, letting the students know what it is that he or she did. We're also looking at the number of praise statements being around 6 to 10 per 15-minute interval if you're looking at the number of praise statements that we could utilize to get high performance. And then specific praise, again, is associated with students' on-task behavior because we're actually telling them, you know, nice job staying on task, nice job working at your seat, that kind of thing. It's very specific to what students are doing. Now in the classroom, praise can actually be utilized in many different ways. Again, it's in the program, which is nice, but you could also do things like using sticky notes. So putting a sticky note in front of each student, and then anytime the student is following the expectations, as an example, you can make a tally mark on the sticky note, but you always want to pair it with praise. So you could say, nice job sitting in the learning position, and that really does feed into number 2. Nice job sitting in the learning position, and then you put a tally mark on the sticky note as one example. Another way you could do it would be to mark on the board, or just provide praise to the students based on them following the rules. The other one is a teacher-kid point game, and I'm going to show you that in a second. We want to have eagle eyes for good behavior, particularly when you're working with students with ASD. You want to zoom in and find as many positive behaviors as possible. And just remember the 5-to-1 rule that we're looking for a ratio of 5 positive statements to every one kind of startup request or sort of the negative behavior that we might see in a classroom. And 5-to-1 is something that I know lots of teachers are really working toward, because if you look at a lot of classrooms, it ends up being flipped in the other way, meaning there are more negative statements to positive statements. If the student is off task, a great way to get them back on is called a redirect or a startup request. Works well with students with ASD, and that would be show me how you. So show me how you respect others, or show me how you sit in the learning position. But what we've got to remember is as soon as they comply, then we need to praise that behavior. And that's a critical one to ensure that once the startup request is provided, that students actually follow through. And then the praise around technique works well, and that's where if you have 2 or 3 students in a group, one student is laying over the table, you can praise the other 2 students as an example with, you know, nice job sitting in the learning position. Or if 2 students are tracking and one is not, you can say, I like the way you're tracking with your finger. But again, remember that as soon as the other student comes back on task or is tracking with his or her finger, that we need to catch students being good and actually praise that. There's the teacher-kid point game. I've used it lots of times. My students have, and so forth. It's highly recommended in direct instruction programs. And it works like this. The expectations, as we went over for STAR as an example, anytime students are working hard in group and following the expectations, you can provide a tally mark under the S for students. And anytime the students are not, then the teacher gets a point. And you set it up as a game for the students to win. Now here's an example of connecting math concepts. It's a lesson, and I just wanted to illustrate how you could use the praise statements, general praise or specific praise statements, and then we'll talk about the 50-50 rule. So general praise would be, you can see this is a scripted program, of course, that it says, you tell me the name for each symbol, get ready, and the students would say 0. And when they say 0, if you use general praise, you could say yes, or nice, or you know, something positive that doesn't tell the student exactly what they did that earned that praise. And again, nothing wrong with it. Specific praise, if the student said for this, tell me the symbol, and the student said 3, specific praise might be something like yes, 3. And then the 50-50 rule again is that half of everything we say should be specific. Would I like more than that? Yes, I would. So would I like 70-30 specific to general? Of course. Again, the more specific we can be, particularly for students with ASD, the better. And then the final one, again, we've got expectations. We're getting choral responding and individual responses. We're being really positive, lots of praise. The fourth one is error correction procedures, very important to include in any instruction, and it's a hallmark of direct instruction programs that we have these fine-tuned explicit error correction procedures. The research behind error corrections, effective feedback related to correcting is a critical aspect of effective instruction. If students are corrected, they're going to continue making the same mistakes. Without the feedback, they'll practice them, and the problem with this is that they will practice them at high levels, and it's very hard to get rid of once they've learned it to mastery. So we want to error correct as soon as possible, as immediate as possible. Behavior problems are likely to happen when we have lots of errors. That means students aren't being successful. And you'll get students who will act out, whether they shut down, being much more externalizing, so throwing things, swearing, aggression, or much more internalizing, where you get sort of the passive non-response, laying their head on the table, that kind of thing. Appropriate error corrections in direct instruction are really predicated on a model, lead test, delayed test kind of format. There is no negativity, so students aren't told, you're not trying, you can do better, no, that's not right. It's really predicated on, I'm going to show you how, let's do it together, now you do it, and then that particular activity is always put in for a delayed test or a starting over. Here's an example of corrective reading, and remember that the corrective reading decoding program was used, and it was a study I mentioned that I was an author on. It was Decoding B1. And so when you're looking at errors, let me put up the response error correction procedure here. This is at a minimum. So for example, the script would say something like, for exercise 1 or part 1 here, what sound, what word. And so if I said what sound and the students said anything but CH, the ch sound, then the error correction here might be something like, my turn, that sound is ch. And then at a minimum, it would be your turn, what's the sound? The students would say ch. And then there'd be a starting over. And you might say, well, wait a minute, how do we start over if we're at the beginning? Then I would finish this, go here, and then pop back to the first one just to give an additional practice. Now, students with ASD, though, you may think about in between my turn and your turn of adding a we do. So it would look like this. My turn, the sound is ch. Say it with me, and we would both say ch. Then it would be your turn. What's the sound? Ch. And then a starting over. Okay, another error that can happen is something called a signal error. And signal errors have 3 parts as well, and that would be something as only when we have 2 or 3 students in a group or more. And that sounds something like this, that if we get echoing, then that means that we need to repeat it. So if one student echoes another, we would say, I need to hear all voices, or right at my signal. Something along those lines, because we want the students to come in together to get the maximum number of instructional opportunities. If they echo, we don't know if the second student actually knows it. So we would do here is if we heard, you know, what's the sound, and we heard ch, ch, ch from 3 students rather than ch, then I would say I need to hear everyone right at my signal, and I would provide it again. That's the repeat the task. Once they say it all together, then we complete the word, keep going, and remember we would have to come back to that. If the error happened on the word shopped, we would take care of business on the word shopped, and then we do a starting over at the beginning of a row. Okay, so in review here, we're going to look at the 4 big ideas of effective instruction. And again, they are, see if you could remember them. The first one being setting expectations, certainly important, and I recommended the use of STAR, again, seen in direct instruction programs, but certainly something that you could implement in your own classroom. Number 2, yes, increasing student engagement, if you got that, and that means that we need to use lots of choral responding, getting students to respond together. One thing I didn't mention, but that would be important, would be that the lower the level of the student, the lower the number of students in the group. So it may be that we're looking at groups of 2 to 3, depending on where the students are. And then also in terms of co-responding, once we're firm as a group, then we're going to do time for turns, giving students opportunities to do it on their own. Number 3, lots of praise. And we talked about both specific and general. We talked about the 50-50 rule, that if we were going to opt for one more than the other, we would opt for specific praise. And finally, we're going to use lots of error correction procedures when the students make mistakes. If they make a response error, that means someone in the group or someone in the pair of students got it incorrect, and we are going to just error correct the group. We don't zoom in on an individual student. We'll do it in a positive manner. If they don't come in together, we'll do a signal error correction, meaning we'll repeat it to ensure that the students come in together. And we do now know direct instruction does offer promise, as you've seen based on these 4 big ideas and also based on the recent research review that we conducted. It does offer promise as an effective instructional program for students with autism spectrum disorder. And I will hand this over to Lindsay so she can field any questions and read those, and we can get into those and answer them.
Hi, thank you for handing it over, Dr. Marshawn Martella. The first question we have here is, you mentioned a few key guidelines on evaluating programs based on research. The big ideas you just went over: praise, engagement, expectations, etc. Which do you think are the most valuable? I'm going to pass it back to Dr. Marshawn Martella, and she can give us her answer to that.
Well, if in terms of working with students with ASD, I would first and foremost look at setting up the expectations for the group. Students need to know how to act and respond in a group, and that just right out of the chute gets students moving in a positive direction. So I would spend a lot of time going over those expectations. And for students who might have lower levels of skills, it might be as simple as teaching them what does it mean to get ready. And there's only one expectation for the group. So what does it mean to get ready? Your eyes are on me, you're sitting straight, and so forth. You know, once you get that, that gives you something to really praise and focus on before you dive into the program. Now, if you're looking at the other 3 expectations, because a lot of work with students with ASD involves one-on-one instruction, I would focus on being as positive as I possibly could. So having lots of praise, lots of specific praise, it would be certainly important. Error correction procedures, I'm kind of rank ordering them here based on that great question. Error corrections are good. And again, some students will shut down during an error correction. So a nice change up might be something like, that was a good try. Here's what it is, now show me, and praising students for coming in at that time. So again, setting the expectations I would rank as number 1, praise a very close second, and error correction procedures. And of course, you know, the co-responding certainly is in there, but again, I'm just predicating that on sort of that one-on-one or multiple student participation in a group. And back to Lindsay if there are some additional questions.
Yes. So some people have mentioned that particularly when you're working with students who have ASD, the engagement piece can be particularly challenging. Do you have any specific tips or techniques to really engage those students? I'll pass it back to Dr. Marshawn Martella.
Well, if you take a look at the studies, those 9 studies, the majority of those 9 studies only picked a task or an exercise to zoom in on. They didn't run the entire lesson. And so it may be that you're zooming in on one particular task or exercise to really firm up before you start building you know, the student's ability to sit for longer periods of time. And so a lot of the studies you saw were actually listed out what activities were taught, for example, like time telling. So it's breaking it down into very, very small parts, almost task analyzing the exercise into pieces. I would actually recommend doing, so you're taking the script and actually breaking it down even more into the whole model lead test kind of format. It's already set up that way, but it may be that you have to tease it out even more given the low level of the student's performance. Once they're able to do that, you can see that you can start to add additional tasks, additional exercises, and actually eventually move into completing a full lesson. Okay, and I'll pass that back to Lindsay.
I don't have any additional questions in the Q&A box right now. I want to open that up to the participants one more time. If you'd like to type something in the Q&A box or in the chat box, we'd be happy to answer your questions. Give it just about another 15-20 seconds here, see if anybody else is interested in asking questions. Or if you had anything else to add, Dr. Marshawn Martella, in the absence of a formal question, is there anything else you'd like to go over or hit again?
Sure, yeah, I can go ahead and do that. Just in summary, we in working a lot with individuals with ASD find that the more that students can make predictions about what the instruction is going to be like, the better off students are. And I've seen a number of my students run lessons where the students with ASD can actually take over the lesson and run the lesson. If you think about it, they could run a corrective reading lesson. It's kind of fun to see. But the reason is because there's a high level of predictability because of the routines that are built into the program. So just wanted to end with no matter what you do, if it can be really based on having students be able to make certain predictions about their learning, that's certainly helpful. There's a commonality in how the script operates. Lots of praise. If there is an error correction, it's a stop, that was a good try, here's how you do it, show me. Again, everything's really based on being positive, and if you do those kinds of things, you'll be really successful with kids with ASD. I appreciate the opportunity today and hope you learned something.